On the 75th birthday of the NHS, and morale within the frontline workforce seems pretty goddamn low. Here's A&E Dr. Andrew Meyerson.
Morale right now on the NHS frontline is pretty terrible. Every time I speak with juniors who are going through the training program out of medical school, it's the foundation program for the first 2 years. Everybody is here for 2 years, and then they are going off to Australia, New Zealand, Canada, places where our labor is valued, where pain conditions are such that you can have a reasonable quality of life. We have the worst waiting list in NHS history, 7.4 million people long. We have, patients that are waiting for, upwards of 15 hours in our A&E department sometimes. People that are dying at home, dying on the backs of ambulances, dying in our waiting rooms because we can't treat them soon enough because we just don't have enough staff. And so the NHS is a very, very difficult place to work right now as we celebrate the 75th anniversary. It's incredibly demoralizing. And, with the state of the service and the state of this government that just does not care about NHS staff or patients, it's no wonder that so many of my colleagues are leaving the profession in record numbers. Why staff suicide is at record highs right now. It's no wonder that so many people are leaving because morale is pretty terrible right now. I mean, the main problems that we have is a decade of severe underfunding. There was a Financial Times article recently that said that the NHS has been underfunded by £40 billion a year for the last decade. The French Health Service, they spend, I think, 25% more than we do on healthcare. The Germans about 50% more than we do. There is a massive difference in the amount of funding that comparable economies in Europe are devoting to their healthcare. And we just haven't done that over the last decade. And that's been an intentional plan from this government, from successive conservative governments, to underfund the NHS and push more people into private healthcare to grow the private healthcare industry. And, it's emblematic of this, within the last couple of years, a major American hospital, the Cleveland Clinic, just opened up a massive new hospital right next to Buckingham Palace. And that says a lot. We are now living in a two-tier system in the United Kingdom where wealthy people can access private healthcare. They can access it rapidly. They can access, high-quality, world-class healthcare. They're paying for it, paying massive amounts of money for it, while the rest of, working people are suffering on the longest waiting list in NHS history, where you can't see your GP for a couple of weeks. You can't be seen in A&E for, under 15 hours. You can't be seen, you can't get your cancer referral for, a couple of months. And people are suffering on that. And this government just does not care. Just look on social media, look around, ads everywhere. Everybody's being bombarded with ads to see a private GP, to get private testing done, to be seen by private clinicians because they want to push more people into this industry. And at the same time, run the NHS down so that, that there is one excellent level of care for wealthy people and, one, very poor, under-resourced public system for the rest of us. And that is unacceptable here in the sixth wealthiest country on the planet. When I think about the level of care that I'm able to give to patients here in the NHS, it's something that I very much value as a clinician, that I don't have to worry about any of the stuff that we worry about in the States. I don't have to ask for a credit card before I see them. I don't have to argue with insurance companies about the type of treatment that they're getting. I just care for my patients according to national guidelines. And, that is the best way to deliver healthcare. And so it is such a huge honor to be working in the NHS. But, this system has been failed by, 10 years of, catastrophic underfunding, underplanning, understaffing, under-resourcing. I wish that, on the 75th anniversary today, we were doing a lot better than we were. But we are in the worst crisis we've ever seen. And so if we want the NHS to survive for the next 75 years, then we have to fight for it. And now is that time. We are in the worst crisis we've ever faced, and we need the public to support all striking NHS workers and to not believe the garbage that this government is feeding them right now.
That was Andrew Meyerson giving a pretty depressing account of working on the front line in the NHS on its 75th birthday. I want to go into a bit more detail about this policy row